Good morning. How are you doing today?
Good morning, Doctor. I'm doing well, thank you.
That's good. What can I help you with today?
I've received this invitation about cervical screening last week and I'm not sure what it means. Can you tell me a bit more about it?
I'm glad you've come in today and I will try and explain this invitation to you. Cervical screening is for women and people with a cervix. NHS cervical screening is also known as a smear and helps prevent cervical cancer and saves thousands of lives from cervical cancer each year in the UK. Cervical screening is not a test for cancer, but a test to pick up the human papillomavirus or HPV, which causes nearly all cases of cervical cancer.
So what is cervical cancer?
Cervical cancer happens when cells in the cervix grow in an uncontrolled way and build up to form a lump, also called a tumour. As the tumour grows, cells can eventually spread to other parts of the body and become life-threatening. Your cervix is the lowest part of your uterus or womb and is found at the top of your vagina.
So how does the virus cause cancer?
HPV is very common. Most people will get the virus at some point in their life. It's spread through close skin-to-skin contact during any type of sexual activity with a man or woman. HPV can stay in the body for many years and can stay at a very low or undetectable level and may not cause any problems. This means an HPV infection may have come from a partner a long time ago. There are many types of HPV, but only some high-risk types can lead to cancer. And the types of HPV that cause cervical cancer do not cause any symptoms. In most cases, your immune system will get rid of the virus without you ever knowing that you've had it. But sometimes HPV can cause cells in your cervix to become abnormal. Your body can normally get rid of abnormal cells and your cervix returns to normal. But sometimes this doesn't happen and the abnormal cells can go on to develop into cancer.
Oh, I see. So what are my chances of getting cervical cancer then?
Having cervical screening lowers your chances of getting cervical cancer. Screening finds high-risk individuals who may develop abnormal cells so that they can be removed before they become cancer. HPV is found on the skin around the whole genital area and can be spread through any type of sexual activity, oral, vaginal or anal. Smoking increases the risk of cervical cancer because it makes it harder for your body to get rid of the HPV infection. The HPV vaccine for young adults protects against the types of high-risk HPV that can cause most cervical cancers. If you've had the HPV vaccine, you will still need to consider having cervical screening when you're invited. This is to check for other high-risk HPV types that can lead to cervical cancer. Having a family history of cervical cancer does not affect your chance of developing it.
So who should get this screening?
It's recommended for anyone with a cervix aged 25 to 64, which includes women, trans men and non-binary people who were assigned female at birth.
And how often should you be screened then?
If you're between 25 and 49, you should have screening every 3 years, and from 50 to 64, it's every 5 years. If you're over 65, you'll only need screening if you've had an abnormal result recently or haven't been screened since age 50.
So what actually happens during the screening?
You will undress from the waist down and lie on an examination table with your knees bent. Either the nurse or a doctor will gently insert a speculum into your vagina to open it and use a soft brush to collect some tissue from your cervix. It's a quick procedure, usually lasting less than 5 minutes, and then this sample is sent to the laboratory to check for HPV.
Is it painful?
Having the speculum put in may be a little uncomfortable. It can be more uncomfortable if you're very tense, so just try and relax.
Okay, so what would the results tell me?
If no HPV is found, then your risk is very low and you'll get a new screening invitation in 3 to 5 years. If HPV is found but no abnormal cells, you'll be asked to retest in a year. If abnormal cells are detected, then further tests like colposcopy may be needed to take a closer look. Colposcopy is a closer look at the cervical cells by a specialist in the hospital. If the screening does not find abnormal cells, this doesn't guarantee that you won't have them or that they will never develop in the future, so it's really useful to continue having the cervical screening test when invited.
Are there situations where screening isn't recommended?
Yes. If you're under 25, screening isn't usually recommended because cervical cancer is rare in this age group and abnormal changes often go back to normal on their own. Also, if you're over 65 and have had normal results before, or if you've had a total hysterectomy, you generally don't need more screening.
That makes sense, thank you.
If that's all, then do please go to reception and book in with the nurse or the doctor to get this done. Remember, screening saves lives. If there are any other questions, then please do let us know.
Thank you, Doctor.
Thanks for coming in today. Goodbye.